Today, we're pleased to feature Alzheimer Society of Calgary and welcome Cindy Bond, Community Education Specialist for Alzheimer Society of Calgary. Cindy has a background in social work and has worked in the social service field in various capacities for 30 plus years. She currently is a Community Education Specialist for Alzheimer Society of Calgary. She is certified master trainer in the gentle persuasive approach to dementia care, opening minds through art, and the best friends approach to dementia care. Welcome, Cindy. Please tell us how and why caring through COVID continues to be the focus of the Alzheimer Society of Calgary.
Thank you, Colleen. Thank you for that introduction. Welcome, everyone. I'm going to start. Thank you for doing the land acknowledgement. I never know, so I always put it in. But I just wanted to talk to you today, you kind of recap what's been going on. We've all heard the phrases, unprecedented times. In fact, I hear from a lot of people working in healthcare that they're tired of hearing that phrase. Words like flexibility and pivot have been used in our service industry as well. We've heard our financial brokers say be patient, the economy is cyclical. We've heard from families and friends of people trying to support someone living with dementia, either at home or in a care setting. And I want to talk a little bit about that today and what we've learned from caregivers. So those are the teachings, or I want to cover some of the teachings from the pandemic, always looking at things optimistically. What have we learned? And then I want to talk about, there's positive outcomes as well. So, things like we've all heard the jokes about the pandemic. The latest one I've heard is I'm not buying a 2022 day planner until I see the trailer, which is one of my favorites. But no doubt about it, we have had our struggles, and we know that caregivers have had their struggles. Caregivers know what it's like to juggle a lot of things at the same time, and they're all too familiar with the concept of sacrifice. It isn't always negative, though. In fact, last week I spoke to a wife, and checking in with her, and she said, her husband was diagnosed with dementia, and they don't count the days anymore. They make the days count. And I said, wow. I asked her permission to use that. So it hasn't been all negative. There has been some positive outcomes I want to talk about. Regardless, it's been a ride, hasn't it? And it continues to be. My hope is that during this time, you've pulled some good people onto this metaphorical ride with you, so it's not as scary and doesn't seem as long as it has been or will continue to be as things change. So like I said, my presentation is to highlight some of what we've learned from caregivers and shed light on what services we offer at the Alzheimer Society. Our experience at the Alzheimer Society, I don't think our experience has been totally unique. We've learned from many older adult serving agencies that they've had similar experiences. And for some of you, however, you may identify your own unique challenges that I may not talk about today. And where do we go from here? I want to talk about that. So in March of 2020, it was hard to think that we're almost going 2 years now. Our staff at the office moved into their homes. This has been my virtual workspace since that time. All the while we thought, we said goodbye to each other and we'll see you back maybe in a couple weeks. Boy, were we wrong. As an organization, we thought about virtual webinars. But like many, I suppose we were busy and never got around to it. So that was a positive out of COVID, if you will, that It gave us the push we needed to put a lot of our services online. It also made us realize the need to maintain our own mental and physical health during this time. As time unfolded, so did the concerns we were hearing from caregivers as well as professionals. We heard from caregivers and professionals that they were doing more with less and feeling overwhelmed and isolated. More and more, we're talking about not only the challenges around caregiving, but people were talking about their fears about COVID and the future because it was uncertain. In the last year, our call volumes at the Alzheimer Society has increased by 43%, which, is quite a lot. So many professionals we have spoken to, of course, had similar experiences. Those that worked in continuing care were have to isolate from their families during this time. So they would reduce the risk of transmission both to their work environment as well as their home environment. They were doing more with less as family caregivers and friends could not come into care. As a result of the isolation to the person living with dementia, many times we heard that there were more responsive behaviors, which was very understandable. That wasn't something that we were all surprised about. So early on, we had the opportunity to partner with Dr. Gwen McGann and Dr. Deidre McCaffrey, I hope I said that right, at the University of Calgary to see how caregivers were doing during the pandemic. 230 were surveyed, and these were the results. So 66% of caregivers are caring for a spouse out of that 230. That was the percentage. And the 24 of caregivers are caring for a parent, so a spouse or a parent. 58% report an increase in time spent caregiving since the pandemic began. And although this was done in early 2021, I would venture to guess a lot hasn't changed, but it will be interesting to find out. Now, what impact did that have on caregivers? Well, their tasks changed. Caregivers started spending more time on providing emotional support for their person living with dementia, grocery shopping, running errands, helping around the house increased, as well with help or assistance with getting outside. And we also saw impacts on supports due to COVID. So an average caregiver went from an average of 5 supports down to 1.6. So that was quite significant. The impact initially on supports was transportation, and we're still hearing from caregivers, although I don't have concrete statistics for you, that still is a concern because of the vulnerability of age of some of our clients. Day programs, some closed down, some have opened virtually, so we're still seeing changes there. Home care hours definitely changed, so that in-home support changed as a lot of Alberta healthcare workers were allocated to other emergency designations. Legal services declined as well in terms of support and what was offered. And support groups, some shut down and some went virtual. But again, we saw that lag as we do when there are changes in culture. And support groups was one of them. Many of them, if not all of them that I'm aware of, are still virtual. So, can't talk about COVID without talking about pivoting. So education, which is what I do, reached more people than ever before. This year, we provided local families with 65 educational sessions, which was an increase of 360%. So over 3,020 people attended these sessions, which is 4 times higher than the year prior. Now, we were very happy about that. Actually, we were over the moon that we were reaching more and more people. However, always on our radar is knowing that not everyone has the technology to connect on this kind of formatting. So that's always something that we're anxious to get back to. Support calls to our dementia support navigators increased by 47%. And respite care through online day programs. So our club, for those of you who are familiar, we do have, or maybe you're not familiar, we do have 2 club locations. They're called Club 36. One is in Harvest Hills and one is at Seton Aged Care. And they are in person now. But through the pandemic, they were online delivering programs. So that continued, and that's how they pivoted. So we also support professionals in their roles any way we can. And what we heard from professionals who are in older adult service sectors, what they were saying is that among the 54 adult service sectors that were polled, 92% believe that social isolation is the top priority that needs to be addressed. So that was something that they were hearing, the professionals were hearing from their caregivers as well, or from those people that they were serving, is that they were feeling very isolated. So that still is definitely a concern, 92% of those polled. So another one that needed to be addressed out of these 54 surveys were service coordination. So that continues to be an issue. I can't help but wonder if because services have changed and morphed into something else, but also service coordination, knowing what's out there is still so important, and getting that message across. And access to information and services, of course, it was the next one mentioned. So similar trends were found when respondents were asked which of the issues they thought could be advanced by the senior sector serving agencies. That's a mouthful. And, definitely these are things that caregivers feel that we can move forward with and that we need to do better. Us at the Alzheimer Society included, that we need to keep these things on our radar. So, and also coordinating those in-home supports, those continue to impact caregivers and those working with caregivers. So what are some of the positive outcomes? Well, I told you about the caregiver who said they don't count the days, they make the days count. That was one of many things that we were hearing. Those who were having difficulty giving up driving during the pandemic, it became easier because they couldn't go anywhere. Family and friends could remove the car or sell the car. We heard that was a little bit easier during the time. There was more family time, and the reason that what many caregivers told us, there was more family time because it had to be scheduled now, which was very interesting. So once it becomes scheduled, there was more time for it, which was an interesting outcome. More activities moved online, making them more accessible for some, like there was art classes, singing groups, virtual museum tours all over the world, a plethora of online learning, and a lot of it was free and continues to be free. We heard from caregivers as well that they really liked virtual support groups because it gave them the anonymity that they wanted or needed when attending a group. So many of them didn't even put on their cameras when joining because they felt more comfortable. So I can't speak for everyone in the city and what support groups that they're offering, but our support groups are full. There's wait lists, but we do have them. We encourage people to connect with us because sometimes movement happens rather quickly. We heard from people that had, just delayed doctor's appointments, that once they could get a phone call with their doctor or attend a virtual appointment, that was happening more regularly. So we heard in the media the opposite, but again, this has just been our experience that quite a few were able to access the doctor a little bit more easily. Again, for some, not all, and counseling services as well. So that was interesting. Some shared that there was it was just easier than going in person for various reasons. Some didn't have transportation to get there as easily. Physical challenges limited that accessibility, so virtual helped in those realms. More access to online education and not having to drive to a day program when road conditions were bad in the winter. So we heard that, it didn't matter what the roads were like, you could still connect with people. Many of our caregivers said that they enjoyed having more time with their person at home. It wasn't so rushed, it was more relaxed. They weren't busy going everywhere. So that was something that was positive. Opportunity to have direct experience of day program with their person. So speaking about our day program at Club 36, because it was online, a lot of times caregivers could sit with their person and actually participate in what was happening as well. So, and a lot of them really enjoyed that. So that was interesting. Curbside shopping was very convenient. Caregivers were working from home were saving money on gas, parking, clothing, lunches, less time traveling. And I think overall, we would have to agree that the pandemic has lowered the stigmatization on mental illness or mental health issues. More and more people are talking about how they're doing and being honest about that. And it's more than I always equated it before to the past saying, how are you doing? Good, see ya. People were actually saying, how are you? And stopping and really wanting an answer and talking about that. Like, let's do coffee, or I'm sorry to hear that. So there was because of that lower stigmatization, there was more openings, I guess, for support, if you will. The resiliency of caregivers, through all of this and ongoing with or without the pandemic, the resiliency of caregivers never ceases to amaze me, but we know that we can never take that for granted. We have to continue to support our caregivers. So, what services do we offer at the Alzheimer Society? We, during the pandemic, we wanted to become more accessible to caregivers and professionals. So we even changed the name of our learning and support team to support dementia support navigators. So that encompasses a little bit more of what they do. So they support people through email, if that's what's convenient, phone calls, video chat, or we have a live chat feature on our website now where you can connect with a registered social worker and they can provide support and help you navigate the system. Of course, we have free educational webinars as well as information. And that's constantly changing. Check out our website because just about every week there's something else we're doing. Connection to the community. Again, I've talked about our adult day program. So now to access our adult day program, you have to contact Alberta Healthcare, Home Care, have a case manager, but we can help you navigate that as well. So even though it's under our umbrella, Alberta Health manages the wait lists. Then we have a First Link program, and the First Link program was designed some time ago. The reason for it was doctors were finding once a diagnosis was made, well, doctors and caregivers realized that once a diagnosis was made, nothing else happened unless the person with the diagnosis or their caregiver came back to the doctor, and the doctor really at that point didn't know where to direct the person or their caregiver. So the First Link program, this link is found on our website, and it's you can download it and fax it to us, fill it out and fax it to us as a professional, or you don't have to be that formal. Caregivers can just pick up the phone and connect with us. But professionals and community, if you're not sure what other ways to support your person, you can definitely fill out this form and send it to us, and we'll do a follow-up with the person and connect with them to see what other services and support we can offer. So our website is constantly changing. There's always new things on it. So check it out at www.alzheimercalgary.ca. Please feel free to call us at 403-290-0110. You can email us anytime at findsupport@alzheimercalgary.ca. So if you have a question, again, we support caregivers, the person living with dementia, and professionals in community. And I just want to clarify, you don't need a diagnosis to access our services, and they're free. So you can follow us on social media, Facebook, Twitter, and Instagram. Now, another way that we pivoted, if you will, during the pandemic is an opportunity came to us. The Mint Memory Clinic pilot came to Alberta this year. The Mint Memory Clinic model was developed in Ontario by Dr. Linda Lee, and it was integrated. It's an integrated team-based model of care that helps improve access for families. Alzheimer's Calgary is very proud to be partnering in Alberta in this pilot, which was launched this year. Members of our support staff are participating as members of the team in the 3-clinic pilot that's going on here. So the clinics are a person-centered, multidisciplinary approach to diagnosis, treatment, and support for people living with dementia and their caregivers. When a diagnosis is made, there are protocols in place to ensure families are immediately connected to resources. And that was, again, another reason for changing our title from support service coordinators to dementia support navigators. The Alzheimer Society of Calgary is an information and support hub for all those impacted by dementia. We have like I said, registered social workers on staff to answer your questions, help you navigate the system, and most often provide a listening ear and help families with challenges in caregiving duties as they arise. We offer an array of information and evidence-based education programs like these webinars and many, many more. We also have presentations with experts, so that's something new for us, or since the pandemic new. We have that adult day program I was telling you, and again, we've partnered with other agencies as well, so they can adapt their capacity to serve an increasing client base. So like I said earlier, we support professionals in the community whenever possible, so building their capacity. So that's something that's been ongoing. So what's next for us? Well, continuing what we've been doing, and always, sending out surveys and making sure that we're doing what's needed. But I did take an opportunity to connect with the ADI, which for those of you who aren't familiar is Alzheimer's Disease International. And they just came out with their 2021 report, and their key findings from the report include 75% of people with dementia globally are undiagnosed, equating to 41 million people. So that continues to be an issue. So that just really reinforced our commitment, if you will, to the memory clinics pilot that's going on. Clinicians, the stigma still has a major barrier to diagnosis. 1 in 3 physicians believe that nothing can be done. So we need to work on that as well. 90% of clinicians identified additional delays in wait times due to COVID-19, so that didn't help. 33% of clinicians in our survey believe that nothing can be done about dementia, so they're not doing anything. There's no follow-up. So like I mentioned earlier. So key recommendations from Alzheimer's Disease International include healthcare systems globally should introduce annual brain health checkups for those over 50. So I don't know what that's going to look like, but it's very interesting. Facilitated by evolution and biomarker science, with the opportunity to promote risk reduction strategies, which we are currently doing now. Governments globally must urgently start to measure and record diagnosis more accurately. So again, getting that diagnosis and as to what type of dementia is part of that accuracy. Accurate measure of diagnostic rates, is the key to treatment care and support to healthcare system preparedness. And challenging stigma continues to be ongoing. So it was really interesting. Part of under our umbrella were the backbone for the Dementia Network as well. And what they did during COVID was they had someone, Roger Marple, I don't know if you know him, he's wonderful. He lives in Medicine Hat, he's living well with dementia, and it was ask him anything. So they opened that up and we partnered with them, and I'm hoping they'll do it again because it was very well attended. So the Alzheimer Society is, of course, very proud to launch the pilot, or help launch that pilot with the Memory Clinic, and we'll continue to do that. And that ongoing collaboration with Dementia Network is going to be, part and parcel. So we'll continue to be here. We're committed to adapting to all those impacted with dementia so that they can live well. And just quickly, I just want to thank our educational sponsors, Gordie Howe Cares, United Way Calgary and Area, and Alberta Retired Charitable Teachers Charitable Foundation. Sorry about that. And that is it for me. And I have no idea the time, but does anyone have any questions? We're a little bit early.
That's okay. We've got good time. If you'd like to end your screen share, we'll open it up. And at this time, we invite you to pop your question into the, I don't know what's happened there. Lost the full view. So we invite you to pop your question into Q&A or chat. We'll be happy to get that to you. So I'm just putting this on gallery here so we can see both, and we'll have Cindy answer some of those questions. In the meantime, Cindy, thank you very much. So great information, and what a great resource Alzheimer Society is for people, particularly being such a comfort to loved ones who are overwhelmed or a little terrified, not certain what is happening with their loved one and what to do for them. So it's great that you've got that. And I loved your terminology and you're navigating, helping people to navigate through, because yes, I'm sure that there is an awful lot of information to try to weed through to understand what you do need to do to help your loved ones. So thank you very much for that information.
Thank you.
I'm also, one of the things that we've learned this year is how important mental health is. And, as we've said previously, is that I think this year just was the year that made people understand that not being okay is okay, and saying I'm not okay is okay, and reaching out for help. So it's great that they have these resources with you, and that the awareness is so increased as well for not only mental health, but like dementia and Alzheimer, and people, learning the difference between how to identify, and the fact that there are more and more, there's more and more information coming out about contributing factors. Even this morning's presentation with audiology is the importance of hearing health, eyesight, the early diagnosis that you referred to, that hopefully the medical professionals are now taking it seriously and making sure that they help with early diagnosis to help people as well. So that's great. I do have one question here. An anonymous. Is there still respite support for volunteers in varsity?
That's a great question. I am not aware of any particularly. However, I would urge you to connect with one of our navigators. They may, because they do this every single day, and where I'm doing more education, they probably are very much more aware than I am.
I did pop into chat while you were speaking, your contacts, the email, website, and phone number. So I would encourage anyone that has any questions that they would like a little more one-on-one to follow up with those contacts. Anyone else have any other questions or even any feedback, any personal experience? We're happy to hear how you've had to deal with your own situations.
Mm-hmm.
But I don't think anybody really realizes how all-encompassing Alzheimer Society is, and the things you do here in Calgary. We have had the pleasure of working with Padma Ganesh in the past as well.
Yes.
Some of our presentations on mental well-being, helping people to identify. We just did one on mild cognitive impairment and dementia.
Yes.
Not too long ago. So fascinating information to learn just exactly what those situations are all about. So